Hi everyone, my name is Andrew Bryan and I'm a student nurse here at the University of Alabama, and I will be performing the medication administration checkoff. The first thing that I'm going to do is I'm going to show you my ID, and then I'm going to go ahead and pan the room. All right, I'm going to set up my camera and quickly grab the MAR. All right, so the first thing I'm going to do is I'm going to go ahead and wash my hands, perform some hand hygiene, and I'm going to let the other nurses know that I'm preparing medication and follow the hospital's policy for a no interruption zone working place while I prepare the medication. And now I will be comparing the patient care order form, which is here, with the MAR, or medication administration record. All right, so now we have, our patient is Mr. Jaguar J. Jones. Mr. Jaguar J. Jones. His medical record number is 417-6352, 417-6352. His allergies are to penicillin. And all right, so the drug is going to be ordered for morphine sulfate. The the dose is 5 milligrams. The route is for an IM injection or intramuscular injection, IM. The time is for every 4 hours, and we have every 4 hours. The documentation is legal per prescription, and the indication is PRN for pain and PRN for pain. All right, so the next thing that I'm going to do is I'm just going to be working off of the MAR, so I'm going to place that over there. And then now I will be going to be performing hand hygiene again. And I will be just working off of my MAR. So making sure that we have, our patient is Mr. Jaguar J. Jones. All right, and the drug is for morphine sulfate. So I'm gonna go ahead for the first check, do this at the same time. So we have morphine sulfate, 10 milligrams per milliliters. The dose is per 5 milligrams. But after doing the calculations, I'll be administering 0.5 milliliters, and I did check that with another nurse. The route is for an intramuscular injection, which I have selected my supplies for his injection. And then we have the time is for every 4 hours. Documentation per prescription is legal. And then for the PRN for pain is the indication. All right, so that was the first check. And now I will be preparing the medication. So I am going to be getting my syringe out. And all right, so I will be applying my blunt tip cannula. But first I need a alcohol wipe, which is right here. All right, so I'm going to be cleaning the vial in a top circular motion. All right, perfect. And then I will be applying the blunt tip cannula. That can go in the trash. And I will be pulling back 0.5 milliliters of air per the dose. And all right, so I'm gonna go ahead and take off my cap and place it here. So I pulled up 0.5 milliliters per the dose, and I will be injecting the air into the vial, which I cleaned the top off with an alcohol pad and alcohol wipe. And if I pull back any air bubbles, you can tap, which I got out. Perfect. So this is the right dose. I'm gonna go ahead and put my arm behind my back, and we're gonna do the scoop method. All right, and now I can apply my clean needle. Oop, now I can actually take the blunt tip cannula off and place this in my sharps container. Now I can apply my clean needle. All right, and that can go in the trash. And I'm gonna go ahead and set that here. So now that I have the medication prepared and drawn up correctly, I'm gonna go ahead and do my second check. And I have this tape here, and I'm gonna do it at the same time. So we have our patient, Mr. Jaguar J. Jones. So I'm gonna rank his name, Mr. Jaguar J. Jones. The drug is for morphine sulfate, which I know that I picked the right morphine sulfate, which I have right here. All right, and then the dose is for 5 milligrams, which after doing the calculations and checking it with another nurse, I'll be I drew up 0.5 milliliters or half a mil. And all right, so that's good for the tape. And then I did select the right syringe for the right intramuscular site. And the time is for every 4 hours. And Mr. Jaguar J. Jones hasn't had his shot for the last 4 hours. And he did tell me that he is in pain. This is the right medication for his pain. And it has been 4 hours, so it is time for his injection. The documentation is legal per prescription, and the indication is PRN for pain. All right, so now I'm gonna go ahead and place this on my medication that I just drew up for him. We're gonna take our vial, our syringe, and the MAR, and we are going to go ahead and go to his room. All right, let's go. Knock, knock, knock. Hi, Mr. Jones. My name is Andrew Ryan, and I'm going to be applying or administering your medication today. How are you? Good. All right, excellent. So the first thing that I'm going to do is I'm going to go ahead and set all my supplies down. I'm going to wash my hands real quick, apply, do some hand hygiene, and I'm going to go ahead and put on some gloves. And then I will be raising your bed up to working height, lowering down the side rail, and then also getting you comfortable for your injection, because we are administering this, or I am administering this for your pain because you had it 4 hours ago. That's all right. Okay, so perfect. So the first thing I'm going to do, I'm going to go ahead, since I raised the bed and already lowered the side rails, I'm going to go ahead and check your ID band. All right, so we have Mr. Jaguar J. Jones. Mr. Jaguar J. Jones, your medical record number is 417-6352. 417-6352. Excellent. And your allergies are penicillin. Allergies are penicillin. Are you allergic to anything else? No? Okay. All right, so I'm going to go ahead and place you right here. And now that I've checked your ID band, I'm going to go ahead and put on my goggles as well. Could have done that with my gloves, but that's okay. And then now I'm going to go ahead and do my last check. So I did check that you are Mr. Jaguar J. Jones. I checked your medical record number, and now we're going to check the drug. So I have the right drug, morphine sulfate, per the MAR, and I pulled up the morphine sulfate from this vial, 10 milligrams per milliliter, which after doing the calculations was 0.5 milliliters and confirming it with another nurse for the right dose, which was 5 milligrams, and then doing the conversion is 0.5 milliliters. And all right, so we know that that's correct. And then the right route is an intramuscular injection. So we're gonna give that on your ventrogluteal side today. Would you like it on your right or your left? Because it looks like you had it on your left side earlier. So you wanna do it on your right? Okay. And then you didn't have this, the time is every 4 hours, and you had this 4 hours ago. And I do not have any new documentation at this time. And then the PRN for pain is for the indication for your pain. All right, so now that we checked all of that, I'm gonna go ahead and prepare your site. So now that you're comfortable, and I'm gonna get a new alcohol pad, and I'm just going to clean in a circular motion, making sure that the skin as well is in good condition. And all right, and which it is, and I can throw this away. All right, so your site is clean, and I will be getting my sharps container. So this can go in my sharps container, and I'm gonna go ahead and spread your skin. All right, you're gonna feel a quick prick. All right, I'm gonna aspirate. I do not see any blood, so I'm gonna go ahead and slowly inject and quickly pull out. This will be going in my sharps container, and I'll get a new alcohol pad, and I will just quickly place that on your skin. How'd you do, Mr. Jones? It seems like you tolerated that pretty well. All right, good. Yes, you are not experiencing any discomfort. Good. So I'm gonna go ahead and get you back to being comfortable. I'm gonna raise up your side rail, and I will lower the bed to the lowest position, making sure that you're comfortable. I'm gonna go ahead and remove my gloves, and I will be performing some hand hygiene again. And all right, so you are comfortable. I'll be back to check on you within 30 minutes to make sure that you had no allergic reactions to the morphine. I'm going to clean up my area and then also make sure to go to the nurse's station and document for any or per the how you tolerated the procedure and the administration of the morphine. And also, I would have I would have checked you for any pre-assessments prior to the shot of medication. And all right, I think that completes the medication administration checkoff. All right, thank you so much. Bye.